Welcome to Z Multimedia Online. Don't forget to follow us on all our socials on TikTok at Z Multimedia, LinkedIn at Z Multimedia, YouTube, ZTV, ID, X, and Facebook at ZFMGH. Do enjoy this video.
You're still tuned into the Business Breakfast on Z101.9 FM with me, Nichrebi Hammond, and that was Lonely at the Top by Ashake. Well, it's lonely for some people, and it's not because of anything. It's simply because they are battling certain sicknesses or diseases that many people do not know a lot about. And this morning, we're talking about a very important something that most of us don't think about until it becomes very serious. We're talking about diabetes. Now, for a very long time, it felt, distant, something that happens to other people. But today, it is quietly finding its way into our homes, our routines, our everyday lives. And in many cases, people don't even know they have it until the complications actually begin. Our lifestyles are changing. What we eat, how we move, how we manage stress, the risk is actually rising. But unfortunately, the awareness, the early screening and support systems are still not where they need to be. And so today we're asking a very important question. Are we paying enough attention? What can we do differently? And I have two individuals joining me for this conversation this morning. I have in studio Hilarie Fraikue. I hope I got the name right. I always miss that. But yes, I have Hilarie, Gracia Hilarie Fraikue, and she's a registered dietitian, and also Dr. Benedicta at Hayford. She's a medical doctor and the president of RTC Foundation. These are the two individuals having this conversation with. Hilarie's in studio. So, Hilarie, good morning. How are you?
Good morning. I'm fine, thank you. How are you?
Yeah, I'm good. Good to see you.
Good to see you.
It's been how many years?
Months.
You're happy saying it.
Not exactly, but we'll talk about that backstage.
All right, anyway, and I have joining us over the phone lines Dr. Benedicta Hayford. How do I call you? Benedicta, Bene? Anyway, Benedicta, good morning. How are you?
Good morning, Mr. Hammond. I hope you're fine.
Yes, I'm well by God's grace. You didn't join us in studio today.
Yeah, I'm outside from carrying, so I couldn't join.
Okay.
So I'm here.
All right, that's fine. Good to have you anyway. All right, so let's get into the conversation. And I'll start in studio. I'm starting very simple. You are a registered dietitian, but when we talk about diabetes, what exactly are we talking about?
I think if you put it in the...
And why should we even care? Why should the average Ghanaian care?
Okay, let me take it from the second question. An average Ghanaian should be concerned because recently a lot of people are dying because of, the primary cause is because of diabetes, right? And diabetes basically, if I put it in the layman's language, you know how people are like, is yeah, so basically insulin insensitivity, your body not being able to break down certain things. That's the whole thing about diabetes. That's the simplest way that anybody that is not in the medical field would understand where I'm coming from. Yeah.
When people say CHRE, the whole idea goes to the amount of sugar that you take in on a regular. But I understand that it is beyond that. There are things that happen to us. We'll talk about that shortly. But let me bring in Benedicta into the conversation. Benedicta, what do you have to add to that? When we talk about diabetes, what are we talking about?
Okay, so thank you so much. When we talk about diabetes, let me come to what we eat, right? So most of the time when we eat food, and the Ghanaian society familiar with carbohydrates, I'm sure you knows what carbohydrates is. So when we take in the food, most of the food that we eat, and especially the carbohydrates, it's breaking down into what we call glucose. So glucose that most of the time you blood sugar. So when you eat, the body will process it to glucose, and in the body we have something called pancreas. It produces what we call insulin. When you eat and then you have the glucose in your body, the glucose is unable to do anything unless what we call the insulin comes in. And this is what makes the glucose valuable to your body. So it pushes the glucose into your cell. that your cells can use it. So let me give you this illustration. So let's assume that you have a big house with a lot of hungry children inside this big house. And you have food. Food is on the compound, is around, and we want to get this food to the children who are inside the house. The insulin that I mentioned is the key to the house. So you can have the food around within the compound. If you don't have the key to open this gate, you can't get the food to reach these children inside. So when we talk about diabetes happens when there's a problem with this key that opens the gate so that you can send the food to those who need them. Right. So insulin, who has diabetes? Diabetes is basically your inability to regulate your sugar levels or your glucose levels. So it's either you don't have the insulin to open up the cells so that the sugar it's not just blood, but it goes into so that your cells use it, or your body is producing insulin, but then your body is unable to use it well. So that will take you to the types of diabetes, right? So for some people, those we call the type 1 diabetics, they do not produce the insulin at all, or the amount of insulin that they produce is very small. They do not have the key to open the door. So they have food, which is they're able to eat, their body is able to produce the glucose. However, they don't have the key or they don't have the insulin so that the body can use it, or the hungry children can actually eat the food. And then the second one, or the second type of diabetes that we have, these people produce insulin all right. They have the key, but the door is jammed in a way, or there's something wrong with the door. So although they're able to produce the insulin, they are unable to use insulin very well. So the door is unable to be opened even though they have the key. So they will eat all right, they have glucose within their system. So, but the glucose is unable to go into their body cells which need the glucose because the insulin is not working. So those are the two main types of diabetes that we have. And I'm sure as we go on, we'll talk about how this affects us. So basically, this is how we see that the individual has high blood sugar, high glucose levels, because so you have the glucose levels or you have the high glucose in blood, the body is able to use it for these hungry cells that really need the sugar that we are talking about. I hope it's clear enough.
Yes, I think so. I believe so. But is this something that develops over time or it just happens suddenly?
It depends. It develops over time, especially the second one. So that's the insulin resistance. Many times resistance do not happen and immediately. It takes a longer time, or it takes a while for your body to become resistant, especially with the type 2, the insulin resistance. So as you are pumping sugar levels, so with the pathophysiology, pumping in the sugar levels, or you're eating foods which have high levels of sugar, your pancreas opens up, or your pancreas pumps the insulin. As time goes on, because of the burden, it will get time. It's either the pancreas is unable to produce enough, or ones which are produced, the cells do not respond very well to the insulin which is being produced. So the second, it actually takes a while. The first one is as a result of your body's inability to produce the insulin. That one also takes a while, though. Sometimes it takes a while because many times it's what we call autoimmune. Your body is fighting the organ that produces. So that one too happens after some time, but then it is faster in manifestation than type 2 diabetes. So the type 1, we mostly see it in children. 1 diabetes, most of the time it is the kids who come with this type of diabetes. The second one is older mothers and our fathers who usually come with this. But we are seeing a new trend. We are having younger people have the type 2 diabetes as well. So I wouldn't want to say it's just for our elderly mothers and our fathers. Right.
I see, but why do so many people underestimate it? Because I don't know why such a thing. I mean, that affects a lot of people will be underestimated. Why do you think so? Why do you think that happens?
Well, you can do with the immune system. Even I'm sure I can even extend it to worldwide. That the average person will go to the hospital, or the average medical care, unless he or she is in pain, right? So we respond to pain, and many times the symptoms of diabetes, the initial symptoms, you don't really have symptoms. Usually, you don't. And the average Ghanaian will respond to pain. So if you are not feeling, you don't have a big sore, you don't have something which is distressing you, you wouldn't want to go to the hospital to check it. So that is the challenge that be very subtle, very painful. People are because they are normal or their activities, they really do not prioritize it. But diabetes is so dangerous that it can affect almost every part of the body. I'm sure that you that but when we talk about all the complications of diabetes can affect every part. You can from your head to down your toes. Diabetes is that's dangerous or that's sneaky, that's tricky. Let me put it that way. So it's quite dangerous, but because we are people who put urgency, only pain, and that is causing us to scream, we take note of it.
I see. Now, we keep hearing also that it's on the rise. I think even Hilarie mentioned that when she started speaking. How serious is the situation? You are also on the ground. How serious is that situation?
So it is. How do I put? That in Ghana we have a lot of people with that. When you look at this, about we can see 2.7 prevalence.
Sorry, repeat that. The line is breaking, so I'm struggling to hear you. Maybe we'll have to find a way to reconnect you over call and then yes. But let's attempt it one more time. So just you mentioned a particular figure.
Hello, can you?
Yes, I can hear you.
Okay. So the diabetes, when you look at our statistics, we have about 2.7% prevalence, and we can translate it as less than 4 million Ghanaians having diabetes. Right, so it was about as of 2024. So there are a lot of people having diabetes, and as I said, that diabetes is severe or very sneaky in that some of us are up to 10 or I think in March. Our Minister of Health, Mr. Akando, he mentioned that about 4 million Ghanaians have chronic kidney disease. I'm sure that
yeah
you are familiar,
we
right?
had a conversation of that.
Of this chronic kidney disease in Ghanaians that compels people to have dialysis. And I mean, people complain about the price and all of that. Most of it, the cause or the root causes from diabetes is the diabetes that is to chronic kidney. Of course, hypertension is part. So when you come to Ghana, most of the what we call the non-communicable diseases, the major ones have hypertension. Those are the two.
All right. All right, Doc. So let's try and reconnect you. Solomon, will producer, will facilitate that shortly. So please hold on for us because the line is breaking, and I'm sure my listeners are struggling to hear you because myself I'm unable to really get everything. So we'll connect you and then bring you back into the conversation. All right. So let me come in studio now, Hilarie. So you are also on the ground. I mean, you get to speak to people and all of that. How serious is the situation from what you know?
I would say that research-wise, the numbers are high, and then practically the numbers are also high, because it's not just people coming with type 2 diabetes or babies coming with type 1. Now, there are lots of pregnant women that are presenting with gestational diabetes, and the major reason is because of our lifestyle. I'm coming from the diet aspect, so I'll just put everything on the lifestyle. From the food we are eating, not having enough rest, not drinking a lot of water, not sleeping, and not being physically active. Because it starts with obesity. That's one of the risk factors of diabetes. Okay. So when a woman is obese and probably has the whole abdominal fat and all that, and then age is a factor, dieting is a factor, physical activity is a factor, all these come into play. And I did a research in 2024 for my school, and then I realized that most Ghanaian women are diabetic. Now, it's not because they are not feeding well or they are not privy to healthy nutrition, but you know how our mothers would cook for kids, cook for their husbands, and they don't eat. I don't know. Yeah. It's something even with me. I cook for my people, and then I'm like, oh, the smell of the food is nauseating. I don't want to eat anything. Yeah. So you tend to pick what you have available to consume. Now, the more you do that, the more you're not checking your calorie content. So you are ingesting a lot of carbohydrates. Like Doc said, the more you're ingesting carbohydrates, you realize that at the end of the day, too much of it is going to be stored as glycogen in your body. There'll be excess sugar. Insulin wouldn't be able to break it down. So there's a research I can talk about. I think I did one I compared the numbers in South Africa and in Ghana, and I realized that most Ghanaian, especially women, working class between the ages of about 28 to about 45 are at risk of diabetes. So a lot of people are facing it. Now, in the space I find myself where I see a lot of pregnant women, I think almost every time a pregnant woman comes in with gestational diabetes, it's not because they had previous records of diabetes, but it's because their eating pattern is not as healthy as it's supposed to be, and it puts them at a risk of having the diabetes.
What's gestational diabetes?
Diabetes in pregnancy. Okay. Sorry, I should have broken it down for you. So not when someone gets pregnant and their sugar levels gets high, and then over a period of time it's termed as gestational diabetes.
I see. So are we seeing more young people? To
be very honest, yes. To be very honest, yes.
And it's likely because of our lifestyle.
Honestly, the lifestyle is the major factor. A lot of people are not eating well. And you know, diabetes has a very close relationship with PCOS. Do you get it? So a lot of young women especially are getting diabetes. Now, men that are having hypertension, cholesterol issues, it all translates down to diabetes. Obesity is not really, I think it's in recent times that people are active in the gym trying to check their health. But like Doc said, until there's pain, they feel like ignorance is bliss. And you and I know this. Until something is, you see like a very terrible scratch, their first point of call is ChatGPT. They don't see the point of coming to see a healthcare professional. They feel like, well, let me just go to AI, figure out what to do. But a lot of people are dealing with diabetes and they don't know about it.
You talk about food. Is it more about what we eat or how we consume the food?
I think it all comes together. What we eat, how the preparation process, and then the timeline for eating.
Break that down.
Okay. Very well. So how the timeline, I will talk about, you're supposed to use 20 minutes to eat, so that you don't consume a lot of air when you are eating. If you eat too fast, you'll be consuming a lot of air. So that's how come a lot of people get bloated and they don't know, how did it happen? That's one. And then what we eat, we have simple sugars and complex sugars. Okay. So simple carbohydrates like the fizzy drinks, the biscuits, the cookies, the toffees, the chocolates, and then foods that don't have high fiber. Now, complex carbohydrates are foods that have high fiber. So maize, sorghum, rye, corn, wheat, right? The starchy root and plantain, cassava, cocoyam, plantain, potatoes, and the likes. All these are complex carbohydrates, which has good fiber. But you realize that most people are not moving towards the complex carbohydrates. They believe in this westernized food. So, let me have fries, let me have matcha. Don't come for me for this, but anyways. Let me have fries, let me have boba, let me have matcha, let me do loaded fries, let me do a lot of basmati rice and all the likes. It doesn't have high fiber. But we have kontomire, we have garden egg stew, we have rice balls, and then palm nut soup, rice balls, and then katenkwan and all that. We have the local staple foods that have high fiber that when eaten in moderation rectifies our glucose sugar. But the Gen Zs of our time believe in westernized food, so that is where the problem is coming from. And you know that continuous consumption of foods that are not healthy would affect your system.
Right.
Now, a situation where you are consuming something like loaded fries, right? Let me use that as an example. It has cheese, it has sausage, it has chicken, it has eggs. The eggs are probably fried, they are not boiled. Cheese has a lot of fat. They're not using avocado pear that has omega-3 fatty acids. Even though the eggs have omega-3 fatty acids, it's not boiled, it's fried. Now, sausages have a lot of, it's a processed meal, so high potassium, high sodium, all that. Now, you are eating that continuously. You realize that you're also not being physically active as you're supposed to.
Right.
So there's debris of fat. That's what I was talking about, the cooking method. If you are boiling yam and you're eating it with kontomire, you are good to go. But if you are frying it, what if the oil you are using is old? It has turned rancid. So all these are contributing factors. The more you consume them, the more you're not physically active, you're not drinking enough water, you're not resting, it piles up. Now, when all these piles up, then you are prone to diabetes. And when diabetes happens, again, like Doc said, it affects a lot of your organs.
Right.
Your kidneys, your eyes, in men, impotency, sometimes in women, infertility, is a whole lot. So it's something that it's something that we really need to pay attention to. That's why I keep telling people that don't wait till you are sick before you meet a dietitian.
Right.
See them, structure your meal, structure your plan, have a physical activity schedule on the side, and have enough rest. Stop doom scrolling on TikTok. I had to say that.
Right. So, I mean, that's so I was actually going to come to the lifestyle. You talked about lifestyle, and I'm wondering which specific lifestyles you are referring to. But let me just announce the lines in case anybody's listening to us and they may want to join the conversation. Well, if you just tuned in, this is Business Breakfast on Z101.9 FM with me, Hilarie Bihamo. Now, this morning we're talking about diabetes and what we can do about it. It's actually a silent killer. We're seeing a lot of people record numbers, and that's why we're having this conversation, so that you can protect yourself and be able to protect the people that are around you as well. You're free to join the conversation. Send us a WhatsApp on 0544 321019, 0544 321019. You can send us a text and I'll read your messages for you. Also, you can send us, drop a comment under our live stream. We're on Facebook at ZFMGH and on YouTube at Z Multimedia. Please drop a comment under the live stream and I'll read that for you. All right, so my guest this morning is Hilarie, Gracia Hilarie Fraikue. She is a registered dietitian, and Dr. Benedicta Hayford. She is a medical doctor and also the president of RTC Foundation. These are the two individuals I'm having this conversation with this morning. All right, yeah, so Hilarie, continue your point. I was asking about the lifestyle. What kinds of lifestyle? Is it just not sleeping early? What are other things?
I think it boils down to eating pattern.
Okay.
Yeah. So you know how the earlier conversation we're having, I was like, lots of people have been told to eat 3 times a day. But usually when I'm talking to my clients, I tell them small but frequent feeding.
Okay.
So if you do small but frequent feeding, it's easier for you to eat 3 times a day. And if you eat at the right designated times, it's easier for you to do that.
What does that look like in practice? The small...
To be very honest, it's not as feasible as we make it seem.
Okay.
Right? But let me try and break it down and make it practical. Now, let's assume that you have a work schedule of 8 to 5 and you wake up at 5 a.m., right? You can have an overnight oat that you did the previous day so that you don't have to struggle with early mornings that you have to eat. Now, you get to work at 7:30. Between 7:30 and 8, you have your breakfast and you have the right amount. So let's say 2 soup ladles of the overnight oats, which comes with your fruits, your granola, your yogurts, everything you want to put together in that. And then if you want to go with bread, maybe a slice of bread or something. And then that's between the hours of 7:30 and 8 or even till 9, depends on you. That is going to fill you up till your lunchtime. Now your lunchtime, you probably want to have fufu. So you have maybe a morsel of fufu, like my fist. And then with your fish or your meat or whatever that you want to have with it, with a lot of soup. Now you get home at maybe 6, and then we tell people that try and have your last meal before 6. Now, because it's a bit not practical for you because you get home at 6, you can decide to extend it to about 7:30.
Right.
Now, because you know you're going to sleep around 10 or 11, you don't have a heavy meal. So that is where you can decide that, let me have a salad. Let me have maybe rice with a little bit of vegetables and chicken. More of vegetables, sorry. Or let me have more protein, more vegetables, less carbohydrates,
Right.
so that your body would not have to struggle to break it down because you're sleeping right after. Now, I usually advise my clients that try and have at least 3 to 5 hours after having your supper before
Okay.
you go to bed,
Right.
so that your body will take its time to break it down before you get to bed. And that also finds a way to reduce bloating, reduce the insulin insensitivity and the likes, and also you don't wake up hungry and tired. Now, there's a phenomenon I tried. If you eat around 10 p.m. and you fall asleep at 10:30, you wake up very hungry.
That's true.
Yes, and
Yeah.
I'm sure everybody has experienced that. So that is why we tell people that it is advisable to have some time after your supper before you go to bed. Now, that is a lifestyle. Now, if you realize, I spoke about portion sizes even when I was talking about the meal.
Yeah.
I spoke about high fiber foods when I was talking about the meal. I spoke about vegetables. Your fufu is your staple foods. You're having your fish that has omega-3 fatty acids. You are having your soup that has your several vitamins and the likes. You have your overnight oats that you eat in the morning that has high fiber, which is coupled with your granola that has a bit of honey, that has sugar in there, and then maybe apples or something, or blueberries, something that you put together.
Okay.
Technically, that's a balanced meal you've eaten in the day. Now, that's a good lifestyle modification. And then water intake. If you can, I mean, it's not possible, but for the girlies that have the Stanley Cup, I'm sure they can do that. if you can try and have at least 4 to 6 sachets or bottles of water in a day. So let me
4
make
to
it practical.
6.
Let me make it
Okay.
practical for you.
Right.
Now, when you wake up in the morning, you can have one before your main meal. That's one. After your first meal, if you want to have water, you can. Maybe you can't take everything, so you take the rest during the hours of 10 and 11. So that's 2 bottles gone. During your lunchtime, you have 1 bottle of water. That's 3. In between lunchtime and supper, maybe you're a bit dehydrated, so you have that. That's 4. After your supper or before your supper, you have another one. That's 5. And then before you go to bed. That's technically 6. So even if you're somebody who doesn't like taking a lot of water, you take water during the time that you're having your meals.
Right.
That's equivalent to 3 bottles or 3 sachets of water, depending on how you go about it.
Okay.
But if you, I always say this when I go on shoes, if you're somebody who is invested in good looking skin, you have to take a lot of water.
Okay.
Yeah.
All right. Let me bring in Doc now. I think Doc has been has been added back on the line. And Doc, are you with us now?
Yes,
All right.
sure.
Okay. Say again.
Can I be heard?
Yes, loud and clear. Yes, loud and clear. All right, Doc. So let me bring you into the conversation. Now, we've been talking, I mean, Hilarie has been speaking about food, really. But I want us to go back to the diabetes specifically. Now, what are some of the early signs of diabetes that you think that many people ignore that they need to be paying attention to?
Okay. All right. So I wanted to touch on the gestational diabetes or the diabetes in pregnancy.
Okay, you
And
can do
then
that. You can do that, then you come back to this.
So women who are pregnant, many times when you get pregnant, you know the pregnancy is really regulated, affected by a lot of hormones. So the associated with pregnancy sometimes cause some level of insulin resistance that affects your sugar control in a way. So for some first notice or to first be told that they have hypertension during pregnancy. When you have that, the gestational diabetes, it doesn't mean you have like pregnancy, so you have diabetes. Sometimes, and in many times after the pregnancy, the diabetes that we said they have, the insulin or the sugar control becomes normal. So the diabetes is seen just in pregnancy because the pregnancy hormones is affecting it. So after the pregnancy, some of them, they are able to have their normal levels of sugar control in their blood. So they don't need medication, so they don't need diabetes medication. So the diabetes is just within the pregnancy. After the pregnancy, it goes away. However, it can sometimes progress. Or for some people, they will see it during pregnancy, but after the pregnancy, whereas other people are not having the diabetes anymore, they will now have the diabetes. So that's why usually after the pregnancy, sometimes we test them again. Sometimes after 6 weeks or even 13 weeks and beyond, we test them again to see that they have diabetes. So if you are pregnant the doctor tells you have diabetes, it doesn't mean that the diabetes is forever or you have diabetes. But then after the pregnancy, you should have frequent tests to know that the diabetes was just pregnancy related and it is gone for it has progressed to what we call the type 2. Yeah, so that's something that some people are not quite clear with. That.
Right.
Right. So the symptoms of diabetes, the early symptoms, sometimes it's not too specific, but because of the phenomenon shared with you, that even though you are eating, the glucose is within your blood, but you're unable to get to the primary cell. Many of the time, those who have diabetes, the early signs that they see is that they get hungry very quickly, because although you are eating, it's not reaching the cells that need it. So they get hungry very quickly. Then they also lose weight, even though and this is very significant, one diabetes related, because they're giving your food or you're giving your child food, but then you realize that the weight is not progressing, the child is constantly feeling hungry. These are something that they for you that this is something that we have to get it. And in diabetes to frequent urination, because along with the sugars, your kidney has to let some of them go. And as the gas is being let go, water also follows it. So they use frequently, and because of that, they also have a lot of sex, or they want to drink water frequently. So those are some of the. But the late one, as I said, that it can affect the whole part. So I can say that the glucose levels, because they are too high, they affect the vessels in your blood, and vessels are everywhere because they push blood, push things, nutrients, parts of the body. So if the vessels, which are sending blood every part of the body, Hilarie mentioned that it can affect potency in men. It's actually true because vessels are the ones which help you with the erection. So if the vessels know that. So with the head, these are the things that prompt people to come. So because these are serious signs that they can't miss, especially with stroke. When someone has stroke, the person will definitely have to come because it's either they collapse, can't remember, it's either they can't, or something is happening. So diabetes can, and later it can cause what we call death, where elderly lose their memory. So diabetes is a culprit. When you come to your eyes, because of, again, the tiny vessels, diabetes can cause vision problems. So if you have vision, you may not have any other signs of diabetes except the problems you have with your eyes, which means that tiny vessels which supply your eyes with enough blood so that your eyes can properly function is getting disturbed. So you have to check your if you are having eye problems, it's a sign for you to go to the as well. Diabetes can have problems. A lot of the time, Ghanaians will say, meaning that I got sick, never saw any signs of sickness, and the person is dead. The doctor is saying heart attack. All these are sometimes the culprits are either diabetes or your heart problems. Diabetes can cause heart problems. Even with the lungs, your breathing, diabetes can cause lung infection. Because many times when you have diabetes, it affects your immune response. So you are susceptible or you can easily get infection. So those who have diabetes, lung infections, urinary infections or UTI, even for women hygiene in their vaginal and health, diabetes can affect you because they are susceptible to infection. It can go on and on. It can affect your liver. It can affect your blood. As I said, infection response. And then the very serious one that I want to talk about before I end with the complications with the wound. And many times, really take note of it. We will leave diabetes. I'm quite sad because of our mothers and our fathers. They will not really control the diabetes well, And because they are susceptible to infection, they'll easily get infected. They'll get a wound, and then the wound will become infected. It's not healing. So you can see someone with diabetes, they've been dressing their baby bandage. Sorry, they use bandage to cover their wound. You open it, it's very small. Then they'll come to the hospital. We'll look at it and we'll know that it's not going to heal properly. So we have to do patient, have to take away the leg. And it's all because of diabetes. So diabetes can lead you to lose a part of your limbs, which is your legs. We amputate them many times. So make sure that if you have an elderly person who has diabetes, the sugar is being controlled well. If there's a wound, it is taken care of properly. Before you know it, they will have amputation. And so I think I can go on. It causes what we call the neuropathy. How do I've forgotten how they say it. It's called affect the nerve. So that one too, it's all signs or it's all complications of diabetes. So it's really a very deadly disease. And it's also called an erectile dysfunction because it destroys the blood cells. It also destroys the nerves. That causes. So it's something that we have to
right.
Yeah.
Yes, our time is up. There are so many other things I'd love us to have a conversation on, but because of our time, we'll have to move on from that. Now, let's talk about a very major part of our conversation this morning, which has got to do with support systems. Now, we keep hearing about the lack of support systems for people like that. Where exactly is a gap in Ghana? Is it the education? Is it the access or follow-up care, or what exactly, Doc?
Working within our Ghanaian system, I think the support system doesn't really come from the health system. I think it comes from Ghanaians who are very stubborn. I say this with no disrespect, but I think that they are very hard of hearing, meaning that come to the hospital. If you're diagnosed with diabetes, you know that you have diabetes. And even though people don't like to hear it, diabetes, hypertension, they are mostly lifelong or long term. So you have to be on medication, especially for a very long time until the doctor is confident enough to say, oh, okay, I'll take off the medications. And even with that, there have to be follow-up. Because once it's damaged, once the process goes on for you to be diagnosed with diabetes, the reversal there's actually like no reversal, or even if there is, it's quite slow. But people don't really like to think about it that way. So we have diabetic clinics where people who have diabetes come and then they take the medication. NHIS has made it such that some of the medications are even subsidized. Right, they are subsidized, so even though they pay for it, it's not as expensive. So just come for clinics. Maybe if you come, sometimes they'll give you a month review or 2 months review. People are very good with their control. We'll give them 3 months review. They come, when you come, we'll check your medication and we'll see whether your medications are helping you or. But this is a situation whereby after all the counseling, after this, you see people who still default on medication. And sometimes, as a clinician, you become quite frustrated, because the same people that you sit down in the consulting room and counsel that this is the medications that you need, this is the disease that you have. If you do not take your medications, I mentioned the complications can affect your kidney, you can get stroke, blah, blah, blah. They will look at you, smile, and listen. Before you know it, they've come back with hyperglycemia, they're in DA or HHS. These are also complications of diabetes. Everything is deadly. So they'll come with all these complications, and sometimes you are frustrated because you feel like you've given them all that you can give. The medications are not too expensive, but the compliance is not really there. Right. So I wouldn't want to. I think Ghanaians just have to continue to educate or advise ourselves that if we really want a very good life, a very quality life in our old age, in our older years, with our family, and you don't have any doctor that we have to cut your leg for you to survive, we have to do this for you.
Right.
We just have to stop to take our medications. For those who have problems with diabetes, if you have a pharmacy close, periodically go there to check your sugar level or your glucose level. I'm sure that pharmacies, they do it maybe 5 cities or 10 cities. In fact, I was checking with mommy, checking with BP mommy. The pharmacies there, they can check for you. If it's something wrong with it, they will let you know and you will come to the hospital. So it's just personal. We don't need anyone to come and tell us anymore. If you have the disease, please take care of yourself and be responsible for your own health. Thank you so much.
Right. Okay. Let me bring in Hilarie into the conversation now. So, I mean, Doc has spoken extensively about some of the things I wanted to ask you, but maybe there's somebody listening to us. They're asking themselves, where do I start with preventing? Because of course, prevention is better than cure, like they say. So, what do I need to do? What do you have to say to such a person?
All right, I would say that if you have family history of diabetes, right, you know that there's something like this in your family, be on the lookout. Make sure that your eating pattern is well regularized. You talk to a dietitian to get you a meal plan, structure your dieting and everything. Make it a point to be physically active. Now, you don't necessarily need to go to the gym if your schedule is not as feasible as other people, but you can do brisk walking, skipping, walking on the staircase, whatnot, just to keep active. Try and have enough rest. And where to start from is a very dicey question, because sometimes people feel like, what do I do? Where do I go next? Yeah. But routine checkup. The same way people randomly check their pressure, randomly check their sugar levels and everything, you should do a routine checkup. So it's not just your sugar level you are checking, but after 3 months, we have something we call glycated hemoglobin, HbA1c. So when you go and you tell them that, I want to check my sugar, the blood testing one, they will do all that for you so that you have a proceeds of what you've seen over the past period. Now, when you also see a dietitian, what they do is that they rectify situations for you. We don't come to heal you magically, but we try to modify things to suit your preferences with regards to food that you are consuming. And I want to add something about support system.
Right.
Usually when it's not the healthcare professionals that do the support, it's the family. So when I talk to my clients, I tell them that if one person is suffering from a disease condition like diabetes, it cuts across everywhere. That means if I'm giving the man high fiber foods, the daughter is eating high fiber foods, the wife is eating high fiber foods, so that it makes it easy for them to be on a healthy pedestal whilst the man is also making sure that he's eating well. So yes, so if you are dealing with diabetes, if you are dealing with anything of the likes, see your healthcare professional, talk to a doctor. Don't just pop any medications into your mouth just because your fellow person is taking a medication, but see a dietitian as well. And then rectify your meal. We wouldn't just tell you to stop eating your fufu or your banku. I would ask you to take it in moderation.
All right, thank you very much. I have some messages here, but let's just touch on maybe one. So the question is that what role should families play to help someone with diabetes? I think you tried to touch on that, but let me hear from Doc in 30 seconds and then we can go. Doc, so same question to you. I mean, what role should the family play to help someone with diabetes?
Okay, that's a good one. When I am on the diabetic clinic and I see younger people fill in their elderly women, their elderly mothers, aunties and fathers, I get so excited. I'm quite impressed. I'm proud. It makes me know that, they care for their mother enough to drive them. Some of them travel very long distance, especially to regional hospitals to send them. So if your family is really all that you have, right? So a family member or relative can help his or her mother, her father, take the medications, bring them for reviews or clinics when they have to. So, yes, because the elderly women, if their family, they are younger nieces, their younger children are not there to help them, basically they wouldn't come, right? So it's the family who are responsible for helping these ones to become compliant on the medication, the diet plan, and everything. It is the family who are into meals. So important, right?
Right. Okay. Yes, our time is up and we have to go now. Thank you so much for your time, Doc, and thanks so much, Hilarie, too, for coming this morning. We're really grateful. I think we've had a very good conversation, touched on quite a number of things, even though there are so many other things. Maybe we'll have to have a conversation again some other time. But really grateful to the two of you for coming.
A pleasure. So much for having me.
Thank you for having us.
All right, you're most welcome. All right, so that was Dr. Benedicta Hayford. She's a medical doctor. She joined us over the phone lines, and also in studio as Gracia Hilarie Fraikue. She is a registered dietitian. These are the two individuals I had this conversation with this morning. Thank you so much for coming, and to you also listening to us. Thanks so much for tuning in right from 6:15 till now. Really grateful that you made time. We're back again tomorrow for the Friday edition of the Business Breakfast on Z101.9 FM, and I'd love to see you. I'd love to have you join me tomorrow for a very good show as well. But until then, please take care of yourself. These are all things that we're just touching on the surface, but you should do a deeper read into them so that you can get to understand exactly what we're talking about. But until we meet again tomorrow, please take care of yourself. And when you think Ghana, think Z. My name is Hilarie Hammond, and I'll see you tomorrow. Up next is The Brighter Side with Jeremy Okorie. I'm Wako. Please.
Thank you for watching. Don't forget to like, comment, and share. And also do follow us on all our socials. On TikTok at Z Multimedia, LinkedIn at Z Multimedia, YouTube at Z TV, IGX, and Facebook at ZFM GH.